IT band pain and tightness is a common issue among cyclists and triathletes. So in this brief video, we'll take a look at why these conditions are so common by looking at what these tissues have to do during the pedal stroke. Once we've done that, we'll take a look at what we've found to be the most effective method to treat these issues in our office. The IT band is the long, dense fascial structure located on the lateral aspect of the hip. And with respect to problems with the IT band during cycling, there's two key anatomical points we want to point out. First off, if we follow the IT band up to the lateral part of the hip, it's important to note that it actually makes a connection with the muscles located here on the hip. On the anterior side, it connects with the TFL muscle, and more importantly, at least with respect to cycling, it also makes a fascial connection back here with the gluteus maximus muscle. Now, the other important thing to point out is lying just underneath this IT band is the vastus lateralis muscle, which is part of the quadricep muscle. Now, here's the big deal of why that's important during cycling. At the top of this pedal stroke, as the thigh comes forward, it generates an anatomical position in which we have a simultaneous flexed position of the hip and the knee. And what happens at the hip during this position is that it creates a stretch on the gluteus maximus muscle. And because that IT band connects with this gluteus maximus muscle, it also transfers that stretch to the IT band. And it will actually pull the IT band up towards the hip during this position. Now, if we move down to the knee, we actually have the opposite situation happening at the knee. As the knee is flexed, it's going to stretch the vastus lateralis, and it's going to pull that vastus lateralis down towards the knee. So essentially what we have happening at the top of this pedal stroke is we have opposing motions of those two tissue layers. We have the iliotibial band being pulled proximally towards the hip, while at the same time we have that underlying vastus lateralis being pulled distally towards the knee. So what happens is we get this relative motion or this relative sliding of those two tissue layers back and forth. And if this happens repetitively over time, which it will with cycling, that can actually create a little bit of a friction between those tissue layers. And over time, it can start to irritate and inflame those tissues. Now, what is going to happen in response to this is it can actually generate or stimulate some scar tissue formation in between those tissue layers. When this happens, it's going to interfere with that normal sliding of the iliotibial band on that underlying vastus lateralis. Now, as the thigh is brought up and down during the pedal stroke, instead of that nice smooth slide, it's going to start to yank and pull on those tissues. And it's usually this point in time when we start to develop symptoms like pain and tightness. So as you can see from our previous discussion, perhaps the biggest issue with treating these types of IT band problems is trying to restore that relative motion between that overlying IT band and the underlying vastus lateralis. And the most effective way that we found to do this in our clinic is with a specialized soft tissue technique known as ART, or active release techniques. So let's take a look at how this works. So if I was treating the patient, the first thing I would do is find that iliotibial band and take a contact with my hand, trying to grab the IT band, and I'm going to take a little bit of a contact up towards the hip. And at the same time, with my other hand, I'm going to take a contact on the underlying vastus lateralis, try to grab that tissue and take a bit of a contact down towards the knee. Then we'll make use of motion by the patient to try to promote sliding of those tissues. So what we would do is first have the patient drop their leg back to clear the table, and then we'd have them drop the leg down towards the floor. And this motion of the leg will create a stretch in these lateral hip muscles. And it's going to create a traction or a pulling of the IT band up towards the hip. And I'm going to help that slide or help that pull with my hand contact. At the same time, I'm going to then have the patient flex the knee. And as we flex the knee, recall that that creates a tension or a slide down towards the knee on the vastus lateralis. And again, I'll help that position or help that slide using my contact. So essentially, with the use of patient motion along with hand contacts, we're really trying to get that tissue sliding on each other and break up some of those scar tissue adhesions that are deposited and are causing a problem in between those two tissue layers. And as I said, it's really this relative motion that is so effective. Without getting this relative motion back, it's really going to be limited on how effective the treatment is, which is why traditional things like stretching or foam rolling are really limited on how effective and how well they're able to treat this type of issue.